Steve Harris. I'm a family physician, been in practice for about 13 years. And I got into Lyme disease really through my father, who runs Hygienics, Nick Harris. He invited me to do research when I was in college and then in medical school when I had time, and really watched the debate unfold as these two camps became established really since 1989. I've been involved in Lyme disease some way or another. And after residency, moved to San Diego, didn't really think I was going to be involved in Lyme, thought I would be working really in the field of international medicine. But then working with Therese Yang in San Diego, I realized that there was such a need for Lyme physicians across the country, and that really working in this field was like working in a bit in a war zone, without resources, without backup, without help, and that these patients were truly in need. So the challenges that I face and that many of the other docs in my practice face are several. First, we have the patient and her or his symptoms and condition. So there's the disease that we have to face. And even pulling all the stops, using every treatment, everything at our disposal, it's still remarkably difficult. Some of these folks, their disease is so recalcitrant to treatment. They've been through every pharmaceutical one can imagine. They've been through umpteen naturopathic, homeopathic, energetic treatments. They've run the gamut of treatments that they've done for years. They've become, in a sense, professional patients. And so the second challenge to just treating the disease is treating a mindset. Having patients detach from their illness as they actually get better, because they take on this role of being a sick role, and as they get better, sometimes all they've known is being sick, and helping them help themselves become well again is a second challenge. The other challenges have probably been touched upon by others, but they include the political climate in treating Lyme. This is no fun to treat Lyme disease. I feel like I'm an island. It is a profession where there's almost no support in the community from other doctors, from health insurance companies. I always feel like I'm the bad guy. I'm spoken about as I'm a pariah or a quack, or that the labs that I use are disreputable labs, which is totally not true. And then to have to rectify every slander, every libel, I don't have time to even stick up for myself. So the political climate, and it seems like it's still getting uglier and uglier. Sure, there's been some amazing work that different organizations have put out, and there's a major political or a PR campaign, and there's new studies that are coming out, and Stanford is starting to be involved in long-term treatment research outcomes and such, or outcomes research. And but there is a movement to bring Lyme disease and the concept of chronic Lyme disease to the fore and mainstream media. But when it comes down to it, some of the decision makers are not willing to budge, and they're not open to budging currently. And so this is, unfortunately, science doesn't seem to be leading the way for a lot of these patients. It almost seems like it needs to be a patient-driven disease, somewhat like HIV was. So the political challenges are huge. The economic challenges are huge. There's the legal fees that come into protecting one's license are huge, and for the patients, the economic challenges are absolutely ridiculous. Patients are not getting medications covered, they're not getting labs covered or office visits, not to mention the natural supplements that are essentially never covered, or the other modalities that patients need. So the challenges are multiplicitous. Gentleman, about 65 years old, from Montana. He had these January 2013 was having extreme attacks, full body attacks, where he would have these lightning episodes of pain shoot through him. He would have about 4 to 6 a month. He had general global pain, fatigue, memory loss, cognitive slowing, and this tremendous pain that was completely debilitating. Had an appointment with him this morning, and his symptoms are essentially gone. He has a few memory issues that he'd like to address, but he is now symptom-free after a fairly standard course of oral antibiotics that we've done now for about 9 months. And he hasn't needed IV antibiotics. He hasn't needed a extended amount of herbal or natural things. He just, his symptoms were extreme, severe, debilitating, and now he's better. And that's just, we get stories like this every day. The primary challenges that we face in treating tick-borne disease are, one, the infection itself. It seems to morph and change, and I think that we are dealing with antibiotic resistance. I think that we're dealing with ever complex organisms, and we're dealing with more co-infections, and we're finding more co-infections and viral infections that might be associated with Lyme. And so I think that the complex and ever complicated nature of Lyme disease itself. So that's one of the challenges that has to do with the organism. The other challenge is of course the political issue, that that there are patients who they've spent all of their time, all of their money, they've lost everything due to this illness, and they're still not they're not able to get treated. There are so many people who feel that they're alone out there because they've been abandoned by their families, and they've been abandoned by the medical establishment and by the medical system, and they just need treatment. Another political another challenge is in the future is going to be the political will at the academia level to initiate the right kind of research studies that are going to change this situation. To do the right kind of studies, the outcome-based research, to allow this disease to come more into the mainstream. It takes a lot of motivation by academicians who, many of them, who are nervous about engaging a field that has so much controversy. It takes a lot of courage. It takes a lot of money. The money seems like it will come if the right researchers will take on the studies. Just knowing through colleagues at Stanford that if we could get the right scientists to initiate studies, there'll be money that will come. So it's the political motivation of academia. The iLabs training program has been a very useful tool. I feel that I no longer am an island, that there are so many receptive doctors, both from Canada, from Australia, from the US, both naturopathic physicians as well as allopathic physicians who are extremely receptive to the concept of chronic Lyme disease compared to the concept of post-Lyme disease syndrome. People who view this infection as a chronic debilitating infection they've all had patients who they have been unable to get fully better. And they've had other patients where they've missed the diagnosis. And so I think that the training program has allowed a lot of these doctors to improve their practice, to really get some of these sickest patients, and not just the sickest, but the bulk of the chronic Lyme disease patients, treatment in their area. Well, the gratification is teaching another doctor how to treat chronic Lyme disease. Part of it is selfish, perhaps, that I won't have to see all those patients because someone else will be able to see them. And at this point, after 13 years in the trenches, I'm ready to take a step back and have some new folks engage at the level that I have been. But the other gratification is just knowing that the legacy of ILADS and that the concepts that so many doctors have put into to making chronic Lyme disease a treatable condition, so these folks don't have to suffer, it definitely provides some solace. What inspires me? Wellness at all levels inspires me. I think, and patients who are willing to win their health back despite all the odds and all the costs. What inspires me are the mothers of autistic children who have done everything for their kids, and their kids are better because of it. And what inspires me are spouses of ill patients who stay with the patients and support them and come to their appointments and are very engaged in their care and allow them to be in a space where they can heal. And what inspires me even most of all are patients who get better and no longer think about Lyme disease and move on with their lives and do something else. The primary benefit of the primary significance of this training program is there are so few doctors who are open and willing to treating chronic Lyme disease. And when they are open and willing to treating chronic Lyme disease, they feel that they have to reinvent the wheel. And in so doing, they make mistakes. So hopefully the training program will minimize those mistakes, will increase their ability to get patients better faster with less adverse events. The program has made me a better doctor. It makes me think about why I do things. After doing things for so long, sometimes it almost becomes rote, or it just becomes a convention that you do. So when doctors are asking questions, when I'm explaining and I need to remember all of the details of why, and I need to go back and look at the studies and remember why the studies, what the studies said, and some of the details. It keeps me refreshed and keeps my skills up to date. If the program is expanded, I think much the better. I think that the amount of doctors who will learn to treat Lyme disease in its chronic form, there'll be more of them. And I think that if there's enough of the doctors treating it the right way, in a safe manner, that more patients are going to get served. And politically, it's going to make a difference as well. You get more doctors in the community hospitals, eventually it's going to extend into academia. The program has been solid and it's been remarkably effective, and I think one of the interesting characteristics of the program is that each of the training doctors, we all have our own way of doing things. We all have, some people are more allopathic, some people are more naturopathic, some people treat more with articles, just teach more with articles, some people teach more with hands-on. I think we all have our own way and our own technique, and each of us seems to be fairly effective. And so it's nice that doctors are able to choose what kind of person they want to work with. And for more information, just contact ilads.org.